Okay, so page 322 is talking about the acute pericarditis. Um, in the acute pericarditis, it's basically inflammation of the pericardium. That is the red arrow. So this is the pericardium over here. I gotta delete it to make it less obvious. Okay, so inflammation of the pericardium commonly presents with sharp pain. Well, it's acute, so sharp pain aggravated by inspiration, it's not relieved, aggravated by inspiration and relieved by sitting up and leaning forward. So that is something that I've seen in New World. This description this is the description of acute pericarditis. It's relieved by sitting up and leaning forward. It's often complicated by pericardial effusion, so sometimes it happens. This is this dark thing between these two white lines. So this dark spot is the pericardial effusion. Um, it presents with friction rub, something to hear on auscultation as well. The ECG changes include widespread or diffuse ST segments elevation and or PR depression. So we have two segments that we're talking about. First one is the ST segment elevation. So, well, this is the baseline, the blue line, okay? This blue line is just the baseline. So we may see an ST elevation. So this is P, Q, R, S, and this is T. So this segment is elevated over here, and then the PR segment is going downwards. And that is something here we see it in V5, but it's actually widespread. Uh, we can see all over the ECG, except of course for the reciprocal leads. They look different. So the causes include surgery, like cardiac surgery, or connective tissue disorders, or cardiovascular events like acute myocardial infarction or Dressler syndrome. That is the immune system attacking the heart itself, or autoimmune, just like an SLE, systemic lupus erythematosus, or rheumatoid arthritis. Also, we can see in radiation, renal failure, and that is uremia. So, if we find uremia in this case, in the case of patient who has acute pericarditis, then we suspect that this patient has developed renal failure. Also, it could be idiopathic. So, this is the most common, of course. So, this is the most common cause of acute pericarditis, but the presumed actual causative problem is just viral. So this is what we presume it is. But it's the idiopathic is the most common form of the causes of acute pericarditis. We also can have infection as a cause of acute pericarditis, just like a Coxsackie B virus, and then neoplasm. So in order to memorize it, all of it is just like a scar in pericardium with 2C, 2R, and 2I in the in. So again, quickly, it's surgery like cardiac surgery, connective tissue disorders, cardiovascular events, autoimmune, radiation, renal failure, then infection, neoplasm, and that's it. So for the treatment of acute pericarditis, it's non-steroidal anti-inflammatory drugs, colchicine, and glucocorticoids with dialysis in case we started to have uremia. So dialysis for the uremia and glucocorticoids, colchicines, and non-steroidal anti-inflammatory drugs. So that's for acute pericarditis. Well, as it says, of course, the name implies it's in the pericardium of the heart. So it's the outermost layer of the heart. While the other disease that we're having here is the myocarditis. So it's an inflammation of the myocardium, all of it, not like the cover. So it is, well, as I said, is just an inflammation of the myocardium. There is global enlargement of the heart and dilatation of all chambers. So because myocarditis is not specific to one part of the heart, we can say that the whole heart is enlarged and there is dilatation of all of its chambers. So it's the myocarditis is a major cause of sudden cardiac death in adults below 40 years old. So we see that a lot, like a lot of patients who die with sudden cardiac death before the age of 40, then a majority of those goes to the myocarditis reason or etiology. So the presentation is highly variable, and it makes sense because it's not specific to one piece of the heart, it's just all of it myocarditis. So the presentation is highly variable. It could include dyspnea, chest pain, fever, arrhythmia, and the arrhythmia specifically, there could be persistent tachycardia out of proportion to the fever is characteristic. So one of the arrhythmias that we can have is just tachycardia, persistent tachycardia, but it's not explained by the fever because, of course, this patient has myocarditis, so it has an inflammation, and every inflammation has fever with it. So in every fever, we have tachycardia, and in this case, we do have this tachycardia, but it's not proportional to the fever. So sometimes maybe the fever is low fever, like, but the tachycardia is too strong or something. So anyhow, they're out of proportion. Okay, the tachycardia is out of proportion to the fever, and this is a characteristic sign to know that we are having a myocarditis in this patient. So the multiple causes of myocarditis are first, it could be viral, like adenovirus, Coxsackie B virus, and then parvovirus B19, HIV, HHV6. Okay, so that's the viral, and also can have lymphocytic infiltrates with focal necrosis, highly indicative of viral myocarditis. So if we see a lymphocytic infiltration with focal necrosis, we that would indicate like high indication, gives high indication of viral myocarditis for the reason or the etiology to be actually viral. So that's if we see lymphocytic infiltration with focal necrosis. Okay. Some other reasons could include parasitic infection like Trypanosoma cruzi and Toxoplasma gondii, and that's for parasitic, and then bacterial like Borrelia burgdorferi. Wow, what a name! Okay, Mycoplasma pneumonia, and then Corynebacterium diphtheria. Okay, that's for the toxins. Oh, that's for the bacteria. Actually, that's for the bacterial causes. Okay. So the bacterial, these weird names. And then for the toxins, we have carbon monoxide could be a cause for myocarditis, or the black widow venom, and that is the insect. One of the causes could be rheumatic fever. If patient has rheumatic fever, then they're also at a susceptibility to develop myocarditis. Also, some drugs causes myocarditis, like doxorubicin, and that is some kind of chemotherapy, plus cocaine as well. It causes myocarditis, and of course, autoimmune conditions also may develop myocarditis, just like Kawasaki disease, sarcoidosis, systemic lupus erythematosus, or polymyositis slash dermatomyositis. Okay. The complications of the myocarditis include sudden cardiac death, arrhythmias, as we said, and heart block as well, dilated cardiomyopathy, heart failure, and a mural thrombus with systemic emboli. So, because it's myocarditis, then it's involving the whole myocardium, so it can affect anything that the myocardium is associated with or supposed to do, just like electricity conduction or ejection through systolic function. So that's why we could have as a complication sudden cardiac death or arrhythmia, heart block, dilated cardiomyopathy, heart failure, and mural thrombus with systemic emboli. And that should be it for page 322.